Hello friends, today we're going to discuss about dependent personality disorder. I'm Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about dependent personality disorder, diagnosis, prevalence, and management. What is this dependent personality disorder? The core element of dependent personality disorder is feeling completely helpless, that is because of low self-esteem, and inept, along with view of others are strong, competent, and they are required in my life. Dependent personality disorder primarily concerned with obtaining and maintaining nurturant relationship with others in a pathological way, my dear friends. As you know, dependent personality disorder is a pathological. However, in a physiological environment in the community, we require help from each other. But if it becomes pathological without the presence of other person, if you cannot live, and it is present in most of the situation, in various range of situations in the life, then dependent personality disorder diagnosis need to be considered. Let's look into the DSM-5 diagnostic criteria for dependent personality disorder. There should be a pervasive pattern with excessive need to be taken care of that leads to submissive and clinging behavior, fear of separation, and this should be present in various contexts of the life. And they should have at least 5 symptoms out of these 8. What are those symptoms? They should have difficulty in making everyday decision without excessive amount of advice or reassurance from others. Need others to assume responsibility for most of the major areas of his life. Has difficulty in expressing disagreement with others because of fear of loss of support or disapproval. Difficulty in initiating projects or doing things on their own because they feel they will fail. They go to excessive length to obtain nurturance and support from others to the point of volunteering to do things that are unpleasant. They feel uncomfortable or helpless when done when they are alone, because of which they lead to exaggerated fear of being unable to care for himself or herself. They have urgently seeks another relationship or as a source of care and support when a close relationship ends. They also have unrealistically preoccupied with fear of being left alone and unable to take care of themselves. So these are the core criteria for dependent personality disorder. Let's look into the prevalence. The prevalence of dependent personality disorder is very less. It is between 0.4 to 0.6%. Management of dependent personality disorder. The diagnosis is done by a clinician, by a thorough, detailed clinical evaluation, clinical interview, collecting collateral information and observation. Of course, projective tests can be used, but they are not confirmatory. The general personality disorder assessment scales can be used, such as PI, SCID-5, MMPI-2, MCMI-3, and PDQ-4. Further, dependent personality disorder scale can also be used. With regard to treatment, there are no good studies for the recommendation of treatment of dependent personality disorder. We do not have any RCTs. However, like any other personality disorder, medications and psychotherapy can be considered. However, evidence-based recommendation for treatment of dependent personality disorder is very difficult simply because there is no research. However, there was a meta-analysis by Simon in 2009 with regard to cluster C personality disorder. They reported that cognitive and psychodynamic psychotherapy is the best choice for treatment of cluster C, which includes dependent personality disorder. However, there are some few open label trials with regard to dialectical behavioral therapy, CBT, group therapy, and social skills training can be considered. Further, World Federation of Scientists of Biological Psychotherapy guidelines recommended to use SSRIs for cluster C personality disorder for symptomatic relief for depression and anxiety. Medication may also have impact on personality disorder. To conclude, my dear friends, dependent personality disorders are they are not very frequent. The prevalence is somewhere around 0.4 to 0.6%. Available evidence indicates towards cognitive behavioral therapy and psychodynamic psychotherapy. However, research in the area of dependent personality disorder, treatment and course and outcome is very poor. Hence, we need to focus on research, my dear friends. Thank you very much for giving your valuable time. Stay safe.